A warm welcome to you from Geneva, Switzerland. I'm Reda Sadki, and very pleased and honored to be co-hosting this session with my esteemed colleague and sister, Charlotte Mbu. So I'd like to start by introducing you and first of all recalling how we got here. Every health worker, everyone who works for health, remembers the COVID-19 pandemic and its consequences. We hope that you are amongst those who remember how 600 alumni of the Geneva Learning Foundation came together starting in March, April 2020, and we began to work together to figure out how we could use our collective intelligence to respond when parents, caregivers, and health workers were both too scared in some cases to go to the vaccination centers, to keep vaccination going, to keep children protected from vaccine-preventable diseases. And you remember how that group of 600 then mobilized 6,000 colleagues from 86 countries all over the world, and within 3 months had actually developed and implemented recovery plans, and then turned their attention to actually preparing for the introduction of COVID-19 vaccines, the first of which on the African continent were introduced in Ghana and Ivory Coast roughly at the same time. So when we looked and understood the power, the significance of what education could do, what education as a philosophy for change could do in bringing together people in the face of a crisis, this is doubled our determination to continue to build the Geneva Learning Foundation. We've now completed our 10th year and entering our second decade, and we saw in 2023 and 2025, we convened groups of alumni who became the first TGLF ambassadors in just a few countries. We'd like to honor them first. You can look at the official list online from Nigeria, Mali, Uganda, and Bangladesh in 2023, and then in 2025 from the Democratic Republic of Congo. But as a preamble, let me just tell you that today we're introducing what is undoubtedly the single biggest transformation of the Geneva Learning Foundation, of our work, and what it means for you, how you can be involved, how you can contribute, and how you can benefit from the work of the foundation. We believe our mission is now focused on building local leadership to face community challenges. And you will see, we'll be sharing more about how we are dramatically expanding and scaling up the number of topics and issues and challenges where we'll be offering learning opportunities not just to learn, but to actually use the Geneva Learning Foundation's implementation engine, this learning to action process that every alumna has experienced, where you choose your actual problem. You don't work on theory or academic ideas, and then you learn the key ideas, the key knowledge. You share experience and use that to inform, to help you do better. And then in the Impact Accelerator, take small weekly steps and see small results. So we have seen in the first 10 years amazing growth of you as leaders and amazing community impact, and that's what we're hoping to take into the next decade, and we hope that you'll be part of this. And of course, we'll be sharing all the details about how you too can become a TGLF ambassador. I'd like to now turn to Charlotte, and we know that there are in fact ambassadors from Nigeria, Uganda, and Bangladesh with us. We'd love to hear from them first. They became the first ambassadors in August 2023. So 3 years on, or 2.5 years on, we'd love to hear from them. Over to you, Charlotte.
Thank you so much, Reda. So I'm inviting the ambassadors to raise their hand. While some are thinking about doing so, I'll just go ahead and unmute. I don't know if Dr. Ndayo Iwot, you're able to unmute yourself. You are a TGLF ambassador from Nigeria. We would like to hear, what are you most proud of, and what would you like to do better in the future as an ambassador? I hope you're able to unmute yourself.
I'm also asking him to unmute, but he may not be available or may not have the connectivity right now. We know there are many ambassadors in the room. Yep. I think, in fact, we heard from...
Yeah, that's okay. Yeah. Thank you so much, Reda. Thank you so much, Charlotte, and I appreciate everybody else. that is on this call at this time. I'm so proud of this platform. I'm so proud of the Geneva Learning Foundation. Yes, 2029 Scholar and Ambassador 2023, remaining focused and passionate with commitment to the cause of immunization in Nigeria in general and the Federal Capital Territory in particular. Yes, it has been a wonderful trip and in this journey, and I want to say that the passion is still high, and I'm having a dual partnership as a Regima Community Care Foundation, working in the communities in the Federal Capital Territory, and also facility level, linking up with a facility that has been accredited recently for Basic Health Care Provision Fund, which is the classic standardized programming in Nigeria to increase access to primary health care services and immunization towards universal health coverage. And enrollment has been done in that facility. So the Geneva Community Care Foundation, as a partner with the Geneva Learning Foundation, is continuing with the work. And I want to also proudly say that within the time as an ambassador, when we launched the measles rubella vaccine introduction in Nigeria, and also when we had the human virus rollout in Nigeria, that my foundation, partnering with the Geneva Learning Foundation, was selected in the Federal Capital Territory to bring in out-of-school children for immunization in the launch by the presidency, that is the wife to the President of the Federal Republic of Nigeria. I had to take in those girls, and they were used for the launch as out-of-school children. And I also said that after that programming, they have been supported, the parents have been supported for the girls to go back to school. And it has been a wonderful trip. I can also remember vividly the efforts by the Geneva Learning Foundation leadership, Reda and Charlotte, to reach out to Nigeria Immunization Corps Performer. That is the Executive Director of the Nigerian National Primary Healthcare Development Agency, through very formal communication, and how I was chosen to be to still remain the ambassador and to push for that engagement to happen, and how the efforts couldn't yield results. But we are not relenting. I've been with the executive director a couple of times discussing other issues pertaining to immunization, but he's not showing interest in the activities of the Geneva Learning Foundation. But I know that as the time comes, he's going to do that, because many of the immunization officers in the national headquarters are on this program. So I know it's a matter of time. We still continue to push in this country, and as far as we are doing our best and showing results and being recognized in national programs, that means he knows where the knowledge is coming from. Virtual engagement in immunization is the best, and I would, at cost effective, I would say that people should encourage members in the country, immunization experts, to join in peer review and innovations to make sure that they push for expansion of access and extension of coverage. I want to thank you once again.
Thank you, Ndayo Iwot.
Thank you.
Just to say, Nigeria was amongst the first countries that had a really strong mobilization of scholars all over the country. We hope that you will not fall behind as many more countries are now, such as the Democratic Republic of Congo. The national team, the national EPI team is actively contributing, participating, supporting scholars all over the country. We would hate to see our Nigerian brothers and sisters fall behind. But thank you so much for this update, and we recognize and acknowledge the amazing community from Nigeria. We're looking forward to hearing from all the countries that are participating. Charlotte, I suggest that we skip we go now to the practical activity. We have shared an article honoring our alumni and ambassadors. And for those of you who are considering, you received the invitation to learn more about the Ambassadors Activation Program we're running in 2026. It is probably the only time, certainly, that we will run it this year. So there will not be another opportunity. But one of the key competencies, one of the skills that you will work on is actually how to spread effectively the information to your colleagues so that more people can benefit from these programs, from sharing of experience, from learning to support each other. So I'm going to do a demo on screen, but I think the most important is for Charlotte to explain what are the steps, and we've shared the instructions in the chat.
Definitely read that. It's quite straightforward. So you have the link to the article where you can already access it in the English language. But most importantly, it's not for you to learn alone. It's for you to be able to share that link. You can use your favorite social media handle, preferably LinkedIn, to share the link to that article, as like Reda is demonstrating on the screen, with colleagues. So I'm trying to just locate the guidance so that I can share that with you right away.
Let me just paste it. Whoops. Yeah. So so we shared this article, and if you've been part of the Geneva Learning Foundation experience, please do share with colleagues. This actually, in today's world, if there is not sharing of what we post, no one will see it. So we really depend on you, and this is where, as an ambassador, then this is part of your role, your leadership, to make the difference. So right now we had only 10 people who had liked the post, 3 comments and 2 reposts. So Charlotte, why is it so important to not just like, but also to repost and comment?
Okay, thank you so much, Reda. So the more you like, the more you repost, the more the algorithm will push out the article so that other colleagues will take advantage of. We know that the key to our learning is really peer-to-peer learning. That is sharing experiences with others. So if we are able to get this knowledge that we have, the best thing to do with it is not to keep it to ourselves, but share it with others. So we encourage you to like, to comment, and tag someone you know, tag a colleague who might be interested, and then you repost on your own platform. You don't just make the article to go viral, but you also grow your own network by doing so. Thank you.
And we have a very simple way. Let's see what is the ambassador potential of this group, because I'm going to reload the page here. And we're going to see how many more comments and reposts we have now that this group, okay, so we're now at 9 comments and 11 reposts. So if you're considering, if you wish to become an ambassador, this is one of the key ways in which you can show your leadership as an ambassador, is by spreading to your colleagues. Of course, it's not just posting online, because clicking online, it's also about going to have those one-to-one conversations. So 9 comments, 11 reposts. That's given the number of people in the number of alumni in our Zoom studio. That's a little bit disappointing. If you have not done this yet, please go ahead. Okay, we have 37 likes, but we still have only 11 comments and reposts. Now, the comments, you do have to think of something you want to say, but I'll show you something is that you can also tag someone. So if I use the @ symbol and then I put Charlotte, and you need to see this, or whatever may be appropriate, that will make sure that Charlotte receives a notification. And that is something simple. Some of you are social media masters, wizards. You'll probably wonder why I'm spending the time on this, but many people still don't know that is how it works. Let's do one more trial, and this is a test. Let's see how the alumni in this room, you join this because you perhaps are interested in becoming an ambassador or renewing your commitment as ambassador. So let's see how many more we have now. All right, 16 comments, 18 reposts. So most people are learning to use the like button, but really it's critical to have the comments and reposts as well. And of course, very important point here from Faiza Rabbani, reading the article first. Many people just click and repost and so on without reading the article. So Dr. Rabbani, we really appreciate you having that Yes, really trying to do justice to what we're sharing. And again, we wish to thank the ambassadors from 2023 for their service and their commitment and their diligence, and look forward to them renewing their commitment in the near future. So we now have the next sequence, which is a very simple question. What is a TGLF ambassador? So Charlotte, I'm going to entrust you to find one or more individuals, maybe at least one person, to tell us what is a TGLF ambassador exactly.
Yeah, Reda, I wanted to move a little bit out of the African continent. So we have one of our ambassadors from Bangladesh, Mohammed Shahidullah. I don't know, Mohammed, are you able to unmute yourself to tell us, as an ambassador, 2023 ambassador, what is a TGLF ambassador? If he is not able to, I'm going to be asking one of the ambassadors from Uganda as well, Ambrose Muhangi. I don't know if you're able to unmute yourself, but really love to hear from you.
Indeed. All right, so we need at least one of the existing ambassadors to tell us what is a TGLF ambassador exactly. And then we'll be able to tell you all about the ambassadors program for those of you who are interested in taking up the mantle.
I see.
Hello.
Hi. Yeah.
I'm so excited to be here.
A warm welcome to you.
I'm Bolu Ative Folosho from Nigeria.
Welcome.
Okay.
Can you hear me?
Yes, loud and clear.
Yes.
Yeah.
Bolu Atife. So what is a TGLF ambassador? Could you answer that question, please?
So TGLF ambassador are ambassadors, people who have been trained by the Geneva Learning Foundation, and they are ready to give back to the community where they came from. Thank you.
All right, wonderful. So Charlotte, now you're going to give us the, let's say, the official version. What is an alumni ambassador of the Geneva Learning Foundation?
With much pleasure, Reda. So first and foremost, you are a recognized leader who represents the health workers of your country, and you're able to share valuable learning opportunities and help your colleagues to join programs of the foundation to solve real problems. You build so that you can build a strong local network to improve health care and ensure no one feels alone in their daily work. So you share simple messages on your phone, on LinkedIn, on different social media platforms, taking only a few minutes each month so that you don't add stress to your already busy schedule. One thing is, as an ambassador, your leadership helps to protect communities and advance your career at the same time.
Wonderful. Thank you, Charlotte. And now we're actually going to tell you about the 3 top benefits from our perspective of becoming a TGLF ambassador. It is a commitment, and we do not want you to jump into it without having given it some thought. Charlotte, how can becoming a TGLF ambassador help guide the future of health? That sounds like quite an ambitious project.
Model helps give back. That is, give back to the community. It's really focusing on problem solving. And so as an ambassadors, you could be invited to engage directly with national and global partners, and your experience can help shape your country's and the world's agenda around health and humanitarian work.
Wonderful. I'm seeing some wonderful, amazing comments. Here's one from Elizabeth Ezeora, who says, I was very proud to be part of this moving team and as a pioneer ambassador. I also learned a lot during the equity training. I'm proud of the certificate given to me. I'd like to participate more in your program and share knowledge with others. So that's exactly why we're here. So the second benefit, Charlotte, for becoming a TGLF ambassador has to do with scholarships. So that's much more pragmatic and personal. It is a personal benefit, but we feel it's fully justified. Can you tell us about that?
Definitely. We know that over the years, all of the learning has stayed free for everyone. But verification, that is certification verification, requires the assessment of the work that you have done, the outputs you have developed during a learning program. So active ambassadors will get the opportunity to access scholarships first when it comes to the verification of their certification, though the learning, as always, still remains free because it's supported either by the foundation or partners.
Exactly, yeah. So we want to make sure we want to keep the open access. So anyone who has the motivation and the will to learn can do so. But then certifying competencies, that actually is the credential, what we call the credential of value, and the active ambassadors. So not just going through the activation, but actually continuously participating, contributing. Those ambassadors will get first access to scholarships that cover these costs. And then there's a third benefit, Charlotte, and that is the facilitation roles at the Geneva Learning Foundation.
Definitely, Reda. We believe that your participation in our programs lead you to have the experience of learning, and so active ambassadors will get the priority invitation to become TGLF facilitators as we roll out new programs. So you can turn your local experience into a very well respected facilitation position in the Geneva Learning Foundation projects and programs.
So that's our next question for you, and apologies because if you see French slides coming up, that's why, because we have them both in the deck. We'd like to hear from those of you now who are considering becoming an ambassador of the alumni of the Geneva Learning Foundation. If you become an ambassador, what do you think will be different for you? What difference do you think you will make? Let me rephrase that. What difference will you make? Or would you like to make for your health colleagues and for the community that you serve? So that question requires a little bit of thought, but please raise your hand as soon as you have something you'd like to share.
Yeah, and as they're thinking about that, Reda, I just wanted to respond to a comment in the chat from Rukaya Dao that said, I'm so glad to be a part again. I can't wait for more experience, but I can't access my LinkedIn now. It has been deactivated. So Rukaya, even if you can access LinkedIn, we have the links to the articles on Facebook, on X, on Instagram. So you could always access the articles and also share with colleagues on those different platforms.
Right, and I see this wonderful comment from Chinyere Ebede. Maybe we can go to Chinyere. TGLF helped me to help others, especially in peer learning. It's a platform that stretches. That's we hope that's a good thing. And we hope, again, becoming ambassador is a step up from being an alumni. It really is making that commitment to really help contribute, become a leader of the Geneva Learning Foundation, as well as a leader in our learning programs. But actually, so we hope you'll find that fulfilling, and we hope we hear. Okay, I see several hands up. Charlotte, who are we going to hear from?
So we'll start with Kura Juf, whose mic is already unmuted, Reda.
All right.
Good afternoon, good evening, everyone.
Yes, Kura.
Hello,
so
are you getting
listening? Yes, we can hear you.
Thank you very much, Charlotte, and also everyone out there listening. It's indeed a pleasure once again to join this wonderful team. It has been a great experience interacting. For me personally, I think this is an advantage because currently, as I was with you, I was working in the Gambia as a principal public health officer dealing with issues of public health ranging from immunization, surveillance, environmental health, and you name them, and more particular of surveillance. And over the years, for the past 3 years, I've been working with the US CDC and also with WHO in Nigeria. So now currently I am at a global platform ensuring that contributing my quota to ensure that we're able to improve immunization and health outcomes in general. So being an ambassador and also working with the Geneva Learning Foundation has really added value to me. So what this platform will help me to better enhance my skill, my networking, not only locally, but also globally. So thank you very much for the opportunity. I would like to stop here and give other people the chance. And also thank you once again for this great platform. Over.
Wonderful. I think.
Thank you so much.
Yeah, go ahead, Charlotte. But that was wonderful. Yeah.
Yeah, really. And it's always a pleasure to reconnect. It's a pleasure to really reconnect with a lot of our alumni So we have Rukaya Dauda. Your hand has been raised for a while. You can go ahead, and I see so many other hands that are raised.
I'll go busy.
Okay, hello, good afternoon, everyone. Thank you very much, Charlotte, for this opportunity. I'm so happy for this chance for rejoining you again. So being an ambassador is going to create a very great experience, and it's going to help me as a physiotherapist. I would like to create and bridge the gap for equity amongst the locals, and also bridge the gap, create awareness for everyone, like even globally. And being in this platform, it has since opened my mind to a lot of ideas, of which I would love to continue with you till how we see everything goes by. And I'm just happy to be part of you guys. Thank you very much.
Thank you so much. Yeah, so we're going to just give you a little bit of a sneak preview of one of the songs we're working on writing, and then actually putting it to music to tell the story of the first 10 years of the Geneva Learning Foundation. It's a bit of a slow start, but before Charlotte tells you about what, I should say, well, actually, how you actually become a TGLF ambassador, I invite you just to listen to the first minute or so of the song as you think about, you consider if this is something you'd like to do. This is more than being a learner.
Of a long dry season, growing through the cracks where the empire splintered. They tried to bury us deep in the night, but they did not know we were seeds of the light. The memory remains. We carry the maps tattooed on the soul, mending the clay of the broken bowl. Kintsugi, gold in the cracks. From the scar comes the strength, from the wound comes the art. We are drawing the poison out of the heart. The distance was a wall they built to divide. The distance was a wall they built to divide. But the water is rising on.
So we've shared the lyrics with you, and we'll be asking the community what you think of the different versions, so that we can choose one that will really become our anthem for this 10th anniversary. And of course, we're honoring all three continents that participate in the Geneva Learning Foundation: Asia, Africa, and Latin America. We're also proud to have participants from Europe, and from North America, of course. And so now we are going to be asking Charlotte to take us through, to tell us exactly what do you have to do, Charlotte, to become a TGLF ambassador. How is that different from being an alumni? And yeah, tell us more.
So for 2026, we are launching what we are calling the Ambassadors Activation Program, and it will enable you, as you join, to build your skills, plan your actions, and grow your career. So you will learn how to communicate clearly, how to listen to colleagues. You'll be able to write your personal story and build a global professional profile. Some of you already have that, but others will be doing so for the very first time or revisiting that profile. And then you actively invite your colleagues to learn with you, and you also help them to register for new programs.
So Charlotte, this is a 4-week program, I believe, which sounds like it's really heavy and intense. But actually, how much time does it really require? Would you say it's heavy and difficult, or would you say it's fun?
I'll say it's fun, but that's me right now. So it's 4 weeks. It's stretched out across 4 weeks. You need just to dedicate a few minutes in a day, or about 2 to 3 hours a week towards the activities, but they are fun activities, because if you spend a few minutes a day on your LinkedIn profile or on Facebook, then those are some of the things you get to be doing or learning. But also it helps you to be able to plan and program yourself when it comes to the work that you do. So during week 1, you're building the foundation of your work as an ambassador. You call to introduce yourself and join the network. You get to read a code of conduct, which is very important for us as a learning community. And then you build your online presence. Some of you already have an online presence that is very active. Some of you have the opportunity to reactivate yours or to build yours. And then you introduce yourself to colleagues from around the world and also write your personal story.
So that's just in week 1. Week 2 is where I believe, let's say, candidate ambassadors begin to give and receive feedback, to learning to support each other and learning from each other. Can you tell us more about what happens in week 2?
So in week 2, you begin to plan simple steps to take action. You choose one action that you can do every month. You pick simple indicators that will enable you to track your success, and then you focus on small actions that fit easily into your busy schedule. Like we said, you don't have to, it doesn't have to replace your day job. It's just setting aside a few minutes a week, an hour a month to get to do these actions. And then you read the stories of 3 colleagues and offer them feedback. That is at the heart of our peer learning initiatives. That is giving and receiving feedback.
And so what happens in week 3? What is the practical side of this? What do candidate ambassadors actually have to do in the real world? Is there anything?
Definitely communication. You get to communicate with colleagues on a daily basis. So in the context of this activation program, you invite your colleagues to learn with you. You review the action plan. So you do what we call peer review. A lot of you know and love that. Review the action plans of 3 colleagues and give them practical tips on how to improve. And then you will share an invitation message online, like what we did earlier on LinkedIn and other platforms that you might have access to. And then you will help at least one colleague to sign up for a new learning activities. We'll be talking a little bit more about that in the coming minutes. And then you report your results. It's always very important to report back and to also record your work so that we can recognize and appreciate what you are doing.
It's critical to make it clear that this is a voluntary commitment. You do this because you want to. If you don't want to, you need to do absolutely nothing. There's no negative consequence. Nothing bad will happen to you if you do not commit to completing this ambassador's activation. If you commit to completing it, we encourage you to really think through, to be clear in your mind why you're doing it. To be clear about your motivation. It needs to come from you. We cannot prescribe it. This is not something you do for the Geneva Learning Foundation. This is something that you do for your colleagues and for the health of the community that you serve. And so by week 4, Charlotte, what do participants actually have in their hands by the time they successfully complete the ambassador's activation?
By week 4, you have an ambassador's plan. You have kind of like a blueprint that will define your work and activities as an ambassador. So you continue to share learning opportunities with your local colleagues. You use the advice, the comments that you got from your peers to improve your action plan. And then you share your action plan and to encourage yourself and other leaders through your reviews and your comments. And then definitely you'll be able to access certification as an ambassador or mission letter. And we'll be looking forward to organizing the next global induction ceremony rather for TGLF ambassadors.
That's right. Yeah. And so across the 4 weeks, we actually want you to think through why you want to be an ambassador. What is your vision? What's your motivation? And what unique skills and capabilities do you bring to the ambassador role? And that's in week 1, to get you started. And again, if you realize that this is not for you, that is perfectly fine. You can still access all of the TGLF programs, participate in all the activities in Teach to Reach, continue to meet, network, and learn. But if you can figure out, crystallize exactly why you're doing it, then the next question is, what exactly are you going to do? And that's what we do across weeks 2 and 3. And again, it can be very small. It can be very modest. For example, we say if it's once a month, you make a commitment that once a month you speak with one of your colleagues and tell them about the current opportunities and help them to actually join a course or a program. That is plenty. Of course, we know many of you are so full of energy and commitment that you do so much more, and we appreciate that. But at that minimum commitment, we do not disregard and we do not dismiss it. So the questions, the activities really help you create. It's not just one more plan. It's really about your leadership. And we help you make it realistic, and also help you do it so that it will help you make a difference. So that's really what the ambassadors program is about. I believe I'm sure there are questions now, and we have a lot more to tell you. We're at the 35-minute mark, but we're going to perhaps just go to Charlotte now to see if there are questions. I see many more messages than I can keep up with right now. Charlotte, what do you see?
Yeah, so Reda, it's a lot of AI.
Right.
Yeah, that actively I was actually deleting a good number of them, but we have a good number of messages, messages around people's commitment to becoming ambassadors and what they'll try to do. So it's important. And I saw there was a question or a request that the slides be shared. I actually shared the ambassadors activation schedule. It's a Word document in the chat that you can consult. It has most of the details of what Reda and I already went through with you. And thanks for resharing that as well, Reda.
All right, wonderful. So now, this is a first, and you are indeed the very first group with whom we're sharing preliminary information about our first ever significant malaria initiative. We'll be announcing the partners. We'll be working closely with partners in the coming weeks and months. But there is a big if, Charlotte, isn't there? And
definitely, Reda, there's a big if, and as always, that if is most often is conditioned by you as a community, us working together.
So here is the situation, and this is where we will see if ambassadors, those of you who have that commitment to take things forward for your community, for your colleagues, can make a difference. This new malaria initiative is significant. We're working on 3 different critical questions around integrating the private sector into the national system, into eliminating the subnational data, or some people call the black hole of data, so improving data quality and use, and then accelerating adoption of new vector control technologies. But right now, we are planning to do this in French only. And if you feel concerned, and if you would like this initiative, which is a peer learning initiative of the kind that you have engaged with at the Geneva Learning Foundation, but this time focused on malaria, if you'd like this to come to your country, and your country people speak English, not French, this is an opportunity where ambassadors can make a difference. We'll be sending out a call to action to share your malaria experience. And if we can reach 1,000 experiences shared, that will confirm that there is demand for this program. If we do not reach 1,000 experiences, again, that is fine. That means there is not insufficient demand around this topic or for the Geneva Learning Foundation's action on this topic. So we'll be sharing the link to share, inviting you to share, starting with your experience. But really the critical piece is to get others, your colleagues, to share experiences. And that experience sharing, Charlotte, why is that so important to us? And is it really about us, or is it about something else? Can you tell us why we ask? We're constantly asking. We often ask you, can you share your experience on this topic, on that topic?
Yeah, it's because we believe that there is a lot of experience and expertise that you have because you are in direct contact with communities. There are challenges that you face that you are able to, or you're making efforts to resolve, not because guidance for that exists in the manual, but because you understand your context, you understand the lived experiences of your communities, and you are trusted advisors. And some of the actions that you're taking are quite innovative, and they could be useful for the larger community, but they will also inform global stakeholders on what is happening, what can be done at the most local level to address these challenges. Case in point, in the context of this program, it's actually challenges related to malaria.
That's right. So just to get a few quick questions out of the way, could you please tell us all the alumni are the ambassadors, or there will be some selection process to be the ambassador? So the answer, you simply being an alum does not make you an ambassador. An ambassador takes it a step further. You need to go through a 4-week activation program, which we're launching today, and we'll be sharing the enrollment link at the end of this live event. So that it does not simply, it's necessary to be an alum in order to be eligible for the ambassadors program, but ambassador is going a step further. Madlabo asked about the recording for the session, so that will of course we always share the recording. And if you don't know, if you're not familiar with our YouTube channel, just look for the Geneva Learning Foundation. Let me see if I can make this a little bit more reasonable size as we go. Yeah, there we go. Now, Iseani Anthony, Charlotte, asks a very important question. We have done all this before. Do we still going back for it? Well, that is entirely up to you. It's true. I think it is to the credit of this amazing, remarkable community of leaders that every time for 10 years, we have asked you to share initiatives, share announcements, share applications to courses, and you have responded in very large numbers. And that has been critical to the continued growth and impact that we've been able to have together. But we know that this is something that we have done together. And we know that it depends on you. And we know that it depends on your continued conviction that this is worth doing. Only you can answer that question for yourself. And if it is right now you don't have time, or you've done it before, you don't see the benefit for yourself, that is fine. It is your individual decision. But we know that there's so many of you who have that deep, profound commitment, not necessarily to me or Charlotte, that is not what we're asking, but to making education central to the work of health and humanitarian response, and seeing education as a tool for the challenges. Charlotte, what else would you say to Iseani Anthony, who says, well, you guys keep asking us to share, what do we get out of it?
So, Reda, I'll just add to that, and I'll have a question that I'll try to answer from Achi in the chat. But Anthony, just to say, for 2023, to you and other 2023 ambassadors from Nigeria, Uganda, and Bangladesh, if you remember, unlike the Global Ambassador Activation Program that we are launching now, there was not this 4-week activation course. And I think you will get guidance, information on how to build your professional profile. So there's also the aspect of networking, having the opportunity to connect with other professionals like yourself from other parts of the world. I think one of the greatest treasures for me being part of this network is the ability to connect and learn from colleagues from elsewhere. But as Reda said, it's really about you evaluating over the course of the 4 weeks, do I really have the time to commit to this activity? And the question from Achi was when the activation course is starting. So like Reda said, we are going to share the enrollment link at the end of this session, and enrollment will be open from now up till the 23rd of March when the course itself will start. So on the 23rd of March, the platform will be open. For the moment, you can only enroll. That is, if you already have an account on Teachfloor, it's just enrolling and logging in to your account. If you don't have an account on the platform, on our Go platform, you'll need to create your account, and there is a tutorial that's helping you to do that. So we'll share all the information that is needed by email after this session, but the enrollment link will already be available here in the chat after towards the end of the meeting.
All right, so are embarking on the celebration of the 10th anniversary of the Geneva Learning Foundation. Now, this kind of obscure, what may seem like an obscure graphic here, is probably the single most profound, significant change at the Geneva Learning Foundation. And we want to go through this change with you. And everything about what we're doing is really being done in response to what you have told us over the years, to everything that we have learned together. It may be fuzzy if you don't have the bandwidth. I'm going to try to explain what the different, there's sort of three panels to look at. And the first one is on the left, is that we're dramatically expanding the number of programs, so thematic areas and specific courses that will be available to each and every one of you. We will maintain the open access principle. The Geneva Learning Foundation will continue to invest so that you do not have to spend a cent in order to access the learning, other than the cost of connectivity. And you can see here that our goals include supporting those of you who are responding to complex disease burdens. We mentioned malaria, but there are other programs around neglected tropical diseases, such as schistosomiasis. And so addressing these disease threats is a major node in the network that we're building for our second decade. Building adaptable and equitable systems. Many of you are alumni of our equity program. We had the inaugural course in September, and that is just getting started. And then navigating crises and vulnerability, whether that's gender in emergencies or NCDs, non-communicable diseases in humanitarian settings. Altogether, we have somewhere between 30 and 50 new courses that are going to be coming out, and each of them uses the unique methodology of the Geneva Learning Foundation. So every time you go through, you focus not on academic or theoretical knowledge, but on the challenge that you actually face. And that is what we call the learner challenge domains. And so that collective intelligence, that implementation engine, where you analyze practice, you validate experience, you strategize action, we're going to be doing that across all of these thematic areas. So while you can get great, amazing technical trainings from many different sources, universities, from the World Health Organization, we believe what's unique here is that ability to meet, connect, and learn with practitioners from all across the world and learning to support each other. We believe then that develops a set of unique leadership capabilities and leads to community change and impact. And this is what we have observed over the first 10 years. But what we're changing now is we're ramping up the number of technical topics, but the cross-cutting theme is on each and every one. We're asking you, what is the challenge that you face? That is where we should start. That is where learning needs to start if it is to lead to action. Happy to pause here, Charlotte, if there are any questions or comments that you see that we should respond to before going to the next and most exciting culmination of this event.
Yeah, Rella, there is a comment in the chat from Matthias Besson. He says there is a direct link between antimicrobial resistance and immunization coverage. We have partners like IVI working with Fleming Fund on this. There is an opportunity for us, the Geneva Learning Foundation, to push for collaborations, especially as the Fleming Fund is closing. Awareness on AMR is generally low among healthcare workers. This community is huge and can make a difference in promoting the fight against AMR. I thought this comment links directly to what you were sharing in terms of us as expanding the scope of thematic areas that we'll be focusing on, but really looking at it from the point of view of challenges people are facing and what they can do, how they can address those.
I see the comment from Amanda and Dorbor. Wonderful to see you again, Amanda. And indeed, mental health is being considered by TGLF. We'll be asking you in the coming weeks and months, what matters to you? What are the challenges that you're facing? And building the programs adapted, tailored to your needs. That is what we're about at the Geneva Learning Foundation. And Faiza Rabbani, who says that TGLF educated you on schistosomiasis in Pakistan, and that you've actually, as a medical doctor, come across patients with schisto in their lab reports, but the medicines were not available in local pharmacies. And that's that cross-border connection, hearing from people, health professionals who work in endemic countries, countries where schistosomiasis is endemic, at least in some areas. So that is very much what we're hoping to push towards too. But there is a risk, and the risk is the following. It's that some of you have an impressive collection of certificates from the Geneva Learning Foundation, but how is that coherent? How does that actually help you advance in your career? So we've been thinking about that, and for those of you who remember Teach to Reach and the manifesto, something that we call the Manifesto for Global Health, which we did in 2023, 1,300 health workers contributed to that manifesto. And since then, we haven't really done much with it. But we realized actually that it contains some profound insights about the challenges you face as a health worker and about what is the kind of leadership that you can exercise, that you exercise every day because you are there side by side with the community. So we realized that your daily work requires more than just technical skills. You're solving complex problems and building trust with your community every single day. What we decided to do is to create a new framework grounded in a manifesto that came out of dialogue of 1,300 health workers, and that this framework could help measure your abilities that often go unrecognized. And this framework recognizes the real challenges you overcome to keep your community healthy and safe. So all of these new courses and programs that will use the process that you're familiar with, the learning to action methodology of the Geneva Learning Foundation, that will now be structured and organized in a coherent way for a number of reasons. There are 5 areas where we believe you prove your value. Number 1, you find the root causes of local problems, and you're better equipped to do that because you're there every day, instead of just treating the symptoms. Number 2, you learn with your peers and you share your experiences to build what we call collective intelligence. Together we can problem solve more than any one of us can, no matter how well degreed, no matter how experienced, no matter their circumstances. Number 3, you build deep trust with the people you serve through empathetic listening. Many of you are trusted advisors to the communities that you serve. Number 4, you use local data to make smart decisions and tell evidence-based stories. And that's also a competency that you have worked across in pretty much all our programs. And number 5, you keep systems running. We know that 1 in 5 of the TGLF alumni work in zones where there is active armed conflict. And yet you keep vaccination going. You keep prevention and care and diagnosis and services going even during difficult crises. But the question we asked ourselves is, who is recognizing that? Is your Ministry of Health recognizing that? Are the international partners recognizing these 5 areas that prove your value? And right now, there is no structured, coherent way to actually, across these 5 areas, say, okay, this person has built their competencies up to a certain level. So that is a problem that we hope to help solve through these different, not only a bunch of new courses, but also a coherent framework where you can prove your worth to your country, but also to your region and to the global partners. And this framework gives you a formal way to show your complex problem-solving skills, to help your bosses see your true leadership value, and you can use it to gain official recognition from your national authorities. So the TGLF certification, that's the concrete proof you need to grow your career and gain respect for everyone. That is what we're hoping for, and that's what we hope to be building with you on the occasion of our 10th anniversary and as we come into our second decade. Back to you, Charlotte, now. I'm sure there are questions and comments, and we welcome your feedback as we think through together, and we'll be giving you the practical information to access the ambassador's activation for those of you who choose to make that commitment.
So there is a question, the Q&A from Bobole Amos. Reda, in light of the new malaria partnership between the Geneva Learning Foundation and the Gates Foundation, how can TGLF further support my professional development and enable me to contribute more effectively to societal health outcomes through my work?
Right. So I would
yes,
say,
Reda.
I would say number one is simply to join the malaria program as well as the other courses and programs. Now, to be clear, we are not a funder. Our mission is the mission of education. So really supporting your capacity and helping you grow that capacity and leadership. That is not going to change. But having said that, we believe that by participating in these programs, you are growing those capabilities, and that will make the biggest potentially. We've seen it make a tremendous difference, a transformative difference for individuals within our programs, and we hope now that to multiply that so that we see transformation for a greater proportion than we ever have before with this new approach that we're launching for our second decade.
Yes, Reda, and there was also a comment from a colleague that talked about having completed the steps for in the peer learning program, but couldn't get certification because he did not receive any peer review feedback. So I think it's worth sharing with colleagues that if you see in all of our peer learning programs, the first thing we ask you to do, step one, as you start to share your experience, is to invite your colleagues. We believe that learning that that collective intelligence is important in the peer learning process. So we ask you to invite your colleagues so that you don't find yourself in a situation where you have answered the question, you have shared your experience, and you have not gotten any peer review feedback. So we encourage you, invite your colleagues so that once you have shared your experience, they can receive your work and provide the feedback that you need to go through the exercise and be certified.
Thank you, Charlotte. Yeah. And I just want to bring this back up. I showed it when we opened this event. We have just 4 minutes left, so we welcome your comments and questions. You can always email us, and we'll be sharing a follow-up message, of course. But really, building local leadership to face community challenges is what our second decade will be about, and that only makes sense if you are still with us. And if you're still willing to put the amazing commitment and leadership that you have to contribute, again, not so much to what Charlotte and I are doing, not to the facilitation, which is our role in which we take our responsibility for, but to supporting your colleagues, receiving support from them, giving and receiving feedback, problem solving together so we can take on these incredibly complex and interrelated challenges where no one country, no matter how powerful, no matter how competent its health professionals, no matter how strong the health system can solve the kinds of problems we're facing in today's complex world.
Okay, thank you so much, Reda.
All right, well, unless there are further questions, we now need to give the actual information to get to the ambassador's activation. I will show you what that looks like, and Charlotte will share the actual links. All right, so when you come here, I actually, let me see if I can actually show the what this will look like for learners. I'm right now in the admin view, but yeah, that should be it. All right. So, all right, this is still in French. This is, of course, open access. And what you want to do is you want to click on enroll. But there is something very simple here that you don't want to miss. If you have already used our Go learning platform, you're going to need to log in. Please do not create a new account with a different email. You will not be able to create a duplicate account with the same email. And we use the email to identify you as an alum. So if we do not recognize the email, we'll be discarding your enrollment. So you can find, the other thing is, there is a tutorial actually for another course. We'll get one up specific to this activation program, but the steps are the same. Just don't get confused. This is our tutorial for HPV. We'll be putting one up specific to this program as soon as we can. You can, and then the steps are to enroll here. But this is the key. If you already have an account, you need to go to log in here. If you forgot your password, you can recover your password here. Any other practical advice you'd like to give, Charlotte, about this?
I think you have said everything that's important, Reda. I've put the enrollment links in the chat for the ambassador's activation in English. So you can go ahead and click. And please do note, as Reda said, if you can take a few minutes just to watch the tutorial, if it's your first time on our Go platform, do not hesitate to do so. But it's quite straightforward. And if you already have an account, do not try to sign up again. You need just to log in. And Shriram Gosavi, we have Telegram, we have a TGLF Telegram channel.
We also have a WhatsApp channel, indeed, Charlotte.
Yeah, WhatsApp community.
So maybe we can include that because there seems to be interest. It's actually the sort of legacy of all the channels we had before. But I think as we enter our second decade, yes, we'll be sharing that in the follow-up email. And then, as we said, we preparing the song of the 10th anniversary. We have several versions. We'll be asking you to choose one. Perhaps we're hoping to be able to do that. But we're going to close then the event, unless, Charlotte, there are more messages or comments needed from us with the song, so you can listen to it. And I've also shared the link to the lyrics.
Yeah, so for those that are asking questions about the Word document, that's the activation schedule we shared earlier. If you have trouble downloading it, I am putting a link where you can click to download the Word document in the chat. And Reda has also just shared the Word document again.
Okay, wonderful. All right, so then we're gonna roll back the song and give everyone a chance to listen. This is really world premiere of the 10th anniversary song of the Geneva Learning Foundation. Once again, thank you, and we look forward to seeing you in our second decade, and really appreciate and want to express my gratitude for your commitment and diligence to the population you serve, to the community you serve, and to each other. Thank you.
They thought the ocean would swallow the drum. They thought the fire would consume the book, but the root drinks in the dark, and the seed waits for the rain. Of a long dry season, growing through the cracks where the empire splintered. They tried to bury us deep in the night. They knew not we were seeds of the light. La memoria, the memory. We carry the maps tattooed on the soul, bending the clay of the broken bowl. Kintsugi, gold in the cracks. From the scar comes the strength. Comes the art. We are drawing the poison out of the heart. The distance was a wall they built to divide, but the water is rising on every side. The knowledge is ours, no longer the beggar at the gate of the king. We are the choir learning how to sing.
A luta continua,
Knowledge gives us grace. We look in the mirror of a stranger's face.
So just to respond to Haske Akiti about downloading the song is still a work in progress. We welcome your thoughts. Welcome your thoughts, your feedback on the song in the Google Doc link shared in the chat. And then we could come up with a couple of other versions so that the whole community can vote the best.
Since the ships came, we kept the lamp. Since the chains fell, we found the spirit. 10 years of the spark, come in the fire. 10 years of the voice, up higher.
And great to see that you were in the house today.
With a turning church. Coming on day. We are together.
Oh, this lyric is fine. Good lyric. This particular one at the back.
Thank you, Dr. Dayo.
Thank you, Charlotte. Thank you so much.
It's the loom of the storm where we spin the new fate. It's the love